Looks like we got a lot of folks on the line. People coming in. Cindy, did you get a new haircut?
Yeah, a little different.
Are you feeling better?
I am feeling much better. Much better. Yes. Thank you.
Wonderful.
Trying to get my kiddo moved up your way.
Yeah, I hope that you're able to find something. As I understand it, a lot of the market up here is so hot for houses that you can't find any rental houses. You can find some apartments, but I think that's even slim pickings in Frankfurt.
Yeah. He's also looking in Lexington and Louisville just to kind of see. But he starts work October 1st, so he doesn't have much time.
Right.
Good morning, everyone.
Hello, hello.
Hope everybody's having a great day.
So far, so good.
Wonderful.
All right, we're getting a lot of folks on here. This is great. Wonderful. Okay, I've got noon Eastern time, 11 o'clock Central. So we will go ahead and get started. I will share with you that we have a very packed agenda today. And as a result, we're going to go through a variety of guest speakers and updates first. Some of them are pressed for time. They have a variety of other commitments, but we thought it was very important to make sure that we got for you during this meeting some updates from those in state government, both from DCBS as well as the Department of Education. And then later in the meeting, we have the program director from the OHS Region 4 is going to be joining us from the federal level to talk about some additional guidance there. I know everyone is concerned these days about the rapid changes with COVID-19. Folks are looking for updates. They're looking for additional guidance. Where are we going today? Where are we going tomorrow? Certainly with the legislature being in session, this is the second day of their special session. Who knows where it's going to go? Some of it looks good. Some of it may not look so good. Just depends on people's perspectives. So with that, let me turn it over to Christy to see if she has any opening comments. And then Sarah, we're going to turn it over to you.
Good morning, everybody. I just want to thank you for your time this morning. I won't be long because I want to turn it over to our guest speakers and respect everybody's time. So I will give more updates later on, but thank you for being here. I appreciate you. And Dr. Vanover, I'm going to turn it over to you.
Thank you all very much for asking me to be here today. I have a few updates from Division of Child Care that will affect Head Start, or there have been some questions related to that. So I wanted to make sure that everybody is looped in. One of the big things is that the All Stars program will be reopening on October 1st. So if you have a licensed Head Start program that is part of the All Stars system, we are re-kicking that off. We've been getting all of our raters reliable, making sure that they're up to date on all of their trainings. And then we will begin going back through in order everybody who has their all-star rating. If you've been waiting, if you're a newer program and have been opened and you're waiting on getting your first rating, those will be starting up soon. And you can always reach out through the All Stars mailbox, or reach out to Shade Chafin or Janet Johnson in our office, as the two predominant central office staff that work with our All Stars team. Of course, we have a lot going on with American Rescue Plan funds right now. I feel like that, I already had a full-time job, and now we got all this American Rescue Plan money, and that is my second full-time job, is to try and get this administered and get all these projects up and running. One of the ones I wanted to specifically talk about with our Head Start programs is scholarships. We are increasing the amount of scholarships that we're going to be giving out during the course of the American Rescue Plan funding. Now, in the past, Head Start had limited accessibility to scholarships, but we are going to open that up during the American Rescue Plan for those who work in licensed Head Start programs. These are the things that you're going to have to think about. If your program already offers a CDA, then your people cannot apply to do a CDA scholarship with us. If you have a large enough program that you get enough training funds that you offer the CDA to your staff, then they will need to do their CDA through you all. But if you have a small program, maybe like Bell Whitley or some of the smaller counties, and you do not have access to a CDA program at your Head Start, then your child care providers that work in a licensed Head Start will be able to apply for the state scholarship funds to get a CDA. Also, with the American Rescue Plan dollars as allowed, we are dedicating $20 million to scholarships for associates and four-year degrees in early childhood education or related fields. If it's a degree in child and family studies with an emphasis on early childhood, or it's early childhood special ed, whatever it is, at state universities in the area, we are going to pay the full tuition for programs for child care providers who work 20 hours a week. Now, previously, we've had a scholarship program. It was open if you work 20 hours a week, but there was a maximum amount of funding per semester up to $1,800, and you could take no more than 9 credit hours per semester. We're altering that during the American Rescue Plan funds. Students can enroll up to full-time. I mean, I worked full-time and went to school full-time when I was in college. We know that a lot of people have learned how to balance that, particularly with online classes or classes that are half a semester, things of that nature. So we're gonna open that up, and childcare providers can apply to a university for an associate's or a four-year degree. And if somebody is the administrator of a childcare program, so they are the director and work a minimum of 20 hours a week in childcare, they can apply for a master's degree if they are an administrator. Now, again, all of these are for people that are working with children at least 20 hours a week. So your all's family staff would not qualify because they're not in a classroom 20 hours a week. Or if you have compliance officers, things of that nature, they would not qualify for the administrative scholarship because they're not in a center 20 hours a week, or rather in the same center. They're kind of floating around, hopping everywhere. But if you have a director for a licensed Head Start, a director for a partnership site, staff that are working in a licensed Head Start, or a licensed center that has partnership sites, those teachers or director would be eligible. Assistant director would be the same way if they're working throughout the center. They might be in a classroom 20 hours a week if they're an assistant director. In fact, right now, the director might be in a classroom 20 hours a week. But that is all open to them to apply for. And the CDA will be open to Head Start staff, but if you have your own CDA program, please don't send your people to apply for a scholarship when you already have those training funds accessible. So those are some changes that current system will only last through the American Rescue Plan. We do not know if we'll be able to continue to open that up for Head Start employees afterwards, because there are limited funds, and you all do receive a good chunk of federal training funds. But this is something that we can do right now with these funds to open up to the whole state to make sure that our early childhood providers are as well trained as possible to work with our kiddos. There's some other things that, yes, they will only, Shonda, I saw your chat. They will only be available to Kentucky schools, and they have to be a resident of Kentucky. It'll be available for state-funded schools. That's the, you know, having the caveat. However, Campbellsville has a big early childhood program. So you could still enroll there, but you would get the state maximum for UK or U of L and not the full tuition for Campbellsville as a private university. Most of our private schools in Kentucky don't have early childhood programs. They have elementary ed programs, but Campbellsville is one of the few that turns out a lot of early childhood graduates. The tuition would include mandatory fees. If the school makes it mandatory to pay a recreation fee or something like that, it would cover that cost. Books would, as part of the Kentucky Scholarship Program, we've done, you know, the center has to pay for half the book, or, you know, those kinds of things. That would still be the case for that, but the cost of tuition will be covered. Other things that may be accessible through the American Rescue Plan dollars, we are increasing the CCAP reimbursement rate. That's getting ready to update again. You know, we increased it by $2 per child per day a couple months ago. It's going to go up to the 80th percentile with the American Rescue Plan starting, I think November 1, you'll be able to bill for that. Those regs are being reviewed internally, and they'll be posted very soon. Other things, we are going to have a trainer academy, 2 different trainer academies, actually. So if you're a credentialed trainer, you can apply to be in the academy. We're going to take 50 candidates, and for a year, there'll be a monthly TOT. You can either enroll in an academy on supporting kids with special needs or an academy on supporting directors. There'll be a daytime and a nighttime training every month, and you can choose between those. There's only one training you have to attend, but we'll have specialists there that will go through a lot of in-depth training for you. If you're a trainer going to the TOT Academy for directors, there might be one session on supporting directors using the food program. There may be one session on labor laws and interview questions that you are allowed to ask and you are not allowed to ask, and things like that. If you're working with, if you apply and are accepted into the academy on supporting kids with special needs, there may be trainings on working with twice exceptional children, working on kids with selective mutism, you know, different things, and really specialize in that. The directors or the trainers sign off that they will attend all 12 trainings and that they will use those trainings in their community for the 2 years following. But everything will be free for the trainers, and they'll get resource and support materials through that process. So that's something that there'll be applications for soon. There'll also be applications soon for facility repairs for centers that have issues like heating, air conditioning issues, roof repairs, things like that, things that are necessary to make the building healthy and safe for the kiddos. And that will be up to $10,000 per center. And that will be something that licensed Head Start facilities will be able to apply for as well. So we have a lot of opportunities coming up that licensed Head Start centers would be able to apply for and participate in. So all that's kind of going on right now as well. Of course, you all know that the General Assembly is in session. There is a current Department of Public Health regulation that requires children 2 and up to be wearing a facial mask while in childcare. It looks as though that regulation will probably be repealed during this session, and we'll see kind of where that goes and what requirements stay in place. So just keep your eye out on that. When decisions are made and finalized, Division of Child Care will send information out to all certified and licensed programs on what the expectation is for child care and what requirements will need to be met. But right now we are following all the typical child care health and safety regs, everything that you know you've always had to do as a licensed facility, with the addition of the masking component. And that is under review by the General Assembly, and they talked about it yesterday in committee hearings. Those are some of the big updates that I wanted to share with you, but I'm also happy to take questions if you all have any at this time.
Does anybody have any questions? All right, Dr. Vanover, thank you so much for your time. We greatly appreciate it.
Not a problem.
All right, we will move on to our next guest speaker, Miss Andrea Bartholomew, the Division of IDEA Implementation and Preschool from the Office of Special Education and Early Learning at the Department of Education. So Andrea, thank you so much for being with us. I'm going to turn it over to you.
Good morning. That's a lot to say for one little title. That's a lot. Joining me is Bill Buchanan. We're going at it together today. And we have just a few little updates for our meeting today, but we're excited to be here, to be asked to come and visit with our Head Start partners. We always enjoy that. So it is time for FOILization agreements. It's time for enrollment. It's time for getting kids back into school, right? And Bill, if you can move to the next slide. We know that enrollment is a struggle right now for everyone. Kids, everything was really good until July, and then July came and it kind of blew up again. So we know that our state-funded preschool programs are experiencing drops in their enrollment. They were kind of getting back on track, and then parents have decided not to send their child because of the COVID virus. They decided to wait and see what is going to happen. What some parents are waiting for this General Assembly to figure out what's happening, with the masking or with time off or with things like that. So I know that state-funded preschool programs are experiencing some real difficulty getting children. Last year, the state-funded preschool enrollment dropped by 5,000 kids or so. It was definitely a hit from COVID. We typically see in the 20,000 range, and last year we were in 15,000 range of students, and that's 3 and 4-year-olds, both with and without disability. That is something I'm sure Head Start programs found similar with their enrollment as well, dropping. We expect, the expectation from the Department of Education, the expectation from me, the expectation from everyone is that school districts will work together and collaborate with their Head Start programs to get every kid in that area services provided in one program or another. We know that kids that go to public preschool, that receive Head Start services, that receive any type of early childhood education, or do better in their outcomes. They do better in kindergarten. They're more likely to be ready. They're more likely to succeed in the future if they have that early foundation. So we need to really work together to get those kids back in our schools, in your programs, keeping track of those recruitment and enrollment efforts, and really getting those kids back in safely. That is a huge issue, I know, for parents, is that safety issue. And we know in preschool, it's really hard to keep kids 3 feet apart. It's really hard to keep that social distance. It doesn't work so well with little ones, but trying the best we can to make parents feel comfortable to send their kids, make our staff feel comfortable to come in, and working with our adults, the grownups in our buildings, to really understand the importance of the work that we do. We really want to focus on that collaboration piece. I know it's time for FOILization, it's time to talk about numbers, all that stuff, that kind of those adult issues. Please know that we're here to support. You have Amanda Flannery as your Head Start Collab Director. Please contact her if you're having issues or you need support with any type of enrollment or service provisions or MOAs, any of that. Let her know. And then, Bill and I have a meeting with her monthly where we go over different things on our end and on her end that really help us to try and support the whole of early childhood better, not just the state-funded preschool program. So please feel free to reach out to her, and she will set up some meetings or some discussions with us where we can get to a point where we can get every kid served that needs us, because that should be our North Star. Those kiddos are out there that need to have a solid foundation, and we're the ones to give it to them. So speaking of solid foundations, I'm going to turn it over to Bill, who's going to talk about the General Assembly situation, which might not be so solid.
Thanks, Andrea. Thanks, John and Christy, and Head Start directors. It's good to be with you today. And I'm very much going to echo what Sarah said about our COVID guidance, all right? Because as mentioned, the General Assembly is meeting right now in special session to enact legislation to curb the spread of COVID-19. So the Senate met yesterday. I believe they met again today. The House, I believe, is in session even as we speak to review proposed legislation that in our case may rescind our education emergency regulation that requires facial coverings in schools, and that the current regulation is what is in effect right now. So to Sarah's point earlier about childcare, it's important for programs to know and understand that right now this is the requirement. It's the expectation that school districts are following and implementing the current requirements outlined in regulation. So, but there is new legislation that is being proposed. And so as I understand it in its current version for school districts, there may be new proposals around remote instruction that may expand to 20 days. New flexibility around teachers, including substitute teachers and teacher requirements and background checks. And so, yeah, and also this test to stay model. So if kids are exposed to COVID-19, if they test, perhaps they can stay in school. So, but again, things are changing. I believe there's several amendments that are proposed. If new legislation is enacted that impacts our current guidance, the department will be providing revised guidance and assistance if needed to assist school districts with implementation of COVID-19 school operation plans. So, well, stay tuned. We just encourage everyone, again, to get vaccinated, to follow the protocols. The goal, I think we all have, is to make sure that we prevent learning loss, get kids back in school safely, and move forward in the school year successfully. So with that, I'm going to stop sharing.
Bill, could you speak a little bit more about what you were saying about teacher flexibility?
I don't know that I'm the best person to speak about that, because that's what's in Senate Bill 1, and I imagine is also in House Bill 1. But as I understand it, it would include some flexibilities around teaching requirement, around retired teachers, for example, allowing them to come back and the conditions in which they could come back in terms of benefits. I think there's also language around classified staff, whether classified staff could provide instruction without supervision. But let me say, this is speculative, right? This is language that's proposed in a bill that has yet to be enacted. Really can't say or know more until we have enacted legislation. And at that point, I think we would be able to say more in terms of guidance and what school districts and Head Start programs could do moving forward.
Thank you.
Bill, thank you so much. I really appreciate your guidance and your information. I do apologize for not introducing you when I introduced Andrea. So please forgive me on that respect. Does anybody have any questions for Andrea or Bill?
Does Bill really need an introduction? I mean, Bill's been around. He's my solid rock for sure. I mean, absolutely.
For those who may not know me, I've been around for a while. So it is great to be a part of your meeting again today and to share this information with you. So if there are additional questions, if not, yeah, we'll definitely turn it back over to you.
All right.
Thank you.
Thank you. I don't see any messages in the chat. I'll give it about a minute here to see if anybody has any questions. All right, if there are no questions, again, Andrea and Bill, we greatly appreciate your time. I don't know if Dr. Vanover is still on the call as well, but thank you to all of our partners. We really appreciate the insight and helping us stay up to date. I don't know if you've had a chance to read, but John did send out information last evening, last night about updates from Mr. Coker and what's going on in the legislative stuff. So, John, I know that we've got a little bit of time here before Ms. Goss is supposed to be on. Do you want to go over any of those updates?
Yeah, I actually think we can probably, given that we've got a lot of folks here. First off, let me just say thanks to Bill and thanks to Andrea, and of course, Dr. Vanover ducked off. But we really appreciate you guys being here, being a part of our conversation. I know that given COVID and given Zoom and everything else, we haven't had you with us, but certainly I hope going forward that we can have you as part of our quarterly conversations. So really appreciate your willingness to be a part of it, and we hope that you'll be with us going forward. Okay, gang, so we've got about half an hour. Let me look at the clock here. We've got about half an hour before Maria Goss is going to be joining us. She's going to be with us at about 1 o'clock. So that's an opportunity for us to hear some federal updates and to ask some questions of OHS and Region 4. So between now and then, I suspect that we probably can accomplish all of our other work that we need to do during this particular call. So if it's okay with you, Christy, I may go ahead and just share the screen real quick.
That'll be great.
Let's go ahead and see if I can find my stuff.
And John, real quick, while you're doing that, to save time, everybody, John graciously went through and looked at our attendance, and we do have 14 grantees present. So we do have an established quorum.
Yeah, and I'd be happy to go through and call the roll if folks would like me to, but we do have a listing of attendees, and I've gone through and checked off those that are here. So we do know who's here. And we are recording this as we have all of our executive committee and board of director meetings. And these are available on our YouTube channel at the end of these meetings. So we're being fully transparent. And if anyone wants to review these meetings, they are more than welcome to do so. Okay, so first and foremost, here's our agenda for today. We've already gone through some of it. So let me just call your attention to our Google Drive. This is the one that we have today for our conversation. And if I can find where's the stuff? There it is. No, it won't let me chat. I'll have to stop share to chat. I'm going to paste this in so that everyone has a link to it in case you don't have it. So this is a link to all of our meeting materials for today. So you should be able to access everything from that link. So looking at our agenda for today, the first item is approval of our June 2021 meeting minutes. Sorry, Christy, I don't mean to get into your business, but that's the first item that we've got. So you've got a copy of that. Let me find it here. And so you've got a copy of that. You can pull it up on your computer and look at it, or you can peruse it here. As I mentioned yesterday during our executive committee meeting, I have tried to stick to the traditional version of meeting minutes. I think KHSA has had in the past more of a meeting summary, but given the fact that we're recording these meetings, I've stuck more to a traditional meeting minutes, which is when did the meeting start? When did the meeting end? Who participated in the meeting? Did you have a quorum present? And what were your action items? So that's what we've listed here for the most part with a little bit more detail. But again, you have the link there to the video recording from the June 8th meeting.
All right. Thank you so much, John, for posting those and having everything organized for us. If y'all want to read through those minutes and if I can get a motion to accept the minutes of the June meeting as written, or if there are any additions or deletions, please let us know. Is there a motion to accept the minutes?
I make a motion to accept the minutes, Jessica Coffey.
Thank you, Jessica. Is there a second?
I'll second it. Jeff Martin.
Thank you, Jeff. All in favor? You can all unmute and we'll just have kind of like a tidal wave.
Aye.
Aye.
Perfect. Any opposed? Thank you. Motion carries. I did want to, before we move on just a second, I did want to bring up in our chat box that Dr. Vanover said that when the application for facility repairs are available, that they will send out that notification on the DCC listserv. So make sure to watch for that. I wanted to make sure everybody had seen that comment from her.
Christy, one thing I'll mention is that the folks from Medformance and then Whitney Powell, they're not scheduled to be with us until 1:30 after Maria Goss. So
Okay.
do the president's report and then get into the financials and then get into some other updates before the 1 o'clock when Maria Goss arrives. So we may have time for some other conversations.
That sounds great. So everybody, I will move on to my president's report. First, I want to thank you all so much for just being the Head Start director of your program. It's not an easy ship to sail right now. We know that there's lots of change and we know that there's lots going on. And so I wish you all well. I hope that you're taking time to take care of yourself and you're staying healthy and safe. Continue to reach out to each other. There's nothing better than me giving Cindy a call or calling Brandy or talking to Jessica Coffey just to have another ear to listen to and bounce ideas off. So please don't hesitate to reach out and ask questions because I will share whatever I can to support each other's programs. I think that's the only way we grow stronger is to work together. I shared a few notes in the executive committee meeting yesterday that I have found very helpful is reaching out and looking at all the new initiatives that NHSA has. If you have not checked into The Academy, they have several different cohorts for new directors, for experienced directors, for site leaders. And so there's some great training opportunities out there that is virtual that can lead and build your program. I've shared previously as well to check out that Back to the Basics. We are using that for our onboarding and beginning of the year training for all of our staff. We'll be starting that soon to finish in the month of September. It just goes over, kind of the who's who of Head Start. We do that as an entire staff. And I'm usually the talking head that goes over all those things, but we're looking into this training option so that staff can take this course at their own pace to learn a little bit more about Head Start and all of our required regulations and information. We separately talk about some of the big topics just to make sure that child abuse and some of the health and wellness topics are covered twice. Let's see here. I guess my other big announcement is just to stay in touch and know that the Fall Leadership Conference for NHSA is coming up in September, and that'll be a great time for you to connect with your representatives. And John always does a fantastic job as our team leader and our team captain to get those meetings set up. So remember, this is our time to highlight what's going well within our programs. They want to know about that. They want to know, especially now, how we're using our COVID dollars to impact school readiness, to support families, to work with children to get their immunizations and everything back up to date. So be thinking of those things. And as we talk to our cohorts in DC, we want to make sure that we're sharing the best and the brightest of what's going on in Kentucky, because that's important for us to be on the forefront. So as John has said before, we want to be at the table, not on the table. And we want to be making sure that they have a great picture of what's going on in our Head Start programs across the state. But we have that, and we just have to be able to tell that great story. So does anybody have any questions for me? All right, Mr. James, I'm going to turn it over to you, sir, for our financial report.
All right. The first thing that I wanted to mention is that we have received almost every grantee's membership dues. We are only missing 4 grantees membership dues. The 4 that we are missing is Ashland's, Boyd counties, Breckenridge County, and Williamstown. So that means that we are at 85.7%. And I think, and John could correct me, but I think that is, we're at September 8th, and we are basically at almost every grantee's membership dues collected. So I know at last year it was like around April, May, and we were still collecting dues up to date. So, I mean, I like to think that's pretty good with collecting dues. And it's still the beginning of the school year with collection. So there's still only a few out. And I know with like every finance department with each grantees a little bit differently, like how you have to collect, and the postal service has been a little crazy like the past year, and it's taking weeks upon weeks to send stuff and get mail. And so hopefully we'll be able to collect and get 100%. So we're almost still there. So that's just an update on dues with membership dues. So John had sent, when he sent the link with the agenda, with the Google Docs, all of the financial records. So this first page that he shows right here, this is just the profit and loss overall. So the new fiscal year started as of July 1st, just like most programs. So as of July 1st, this is the profit and loss form. And then if you go to page 2, it goes in more detail about things that have been spent out and then things that have came in. So that has those things that have spent out. And then, like I said, John can go in more detail that KHSA does not have like a agency credit card. John uses his own personal credit card, and then he gets just reimbursed for whatever he needs to spend for KHSA. And then you can see here those different type of office supplies and things like that that's needed for KHSA. And then the things that have been deposited and things like that is mainly all the KHSA dues for all of the grantees. And then if it looks a little bit differently compared to in years past, these are more simpler forms that John has created, which is a lot helpful compared to years past, because in years past, if you're not really familiar with financial documents and things like that, it just looked really just like a whole bunch of numbers and things. So, but yeah, page 2, it just gives more detail about what's being spent out and then what's being brought in. So this is what page 2 is. And then if you go down to page 3, it even goes into like why it's been spent out, why it's been brought in. So this is just the balance sheet. What page 3 is, it's the standard balance sheet, and then where did it come from, and then it even explains why. And then basically if you go on, it's just the deposits, which again is basically all of our membership dues from the different grantees and things like that. So our overall balance is from since May is at roughly around $48,000. So, and again, John can go in more detail about specific finances, but that's where we're roughly around, as of May 3rd, is around the $48,000 mark for KHSA.
Yeah, and let me clarify on that, James. The $48,000 mark, that's what's in our Fifth Third Bank business checking account. That does not reflect what is in our, they've changed their name. They used to be the Kentucky Employee Credit Union. Now they're called Expree. They've rebranded themselves. But the Expree Credit Union, which is just up the street from our offices here in Frankfort, that's where we have our reserves and our certificates of deposit. So we have other money that's set aside from our business checking account. So just in our business checking, we have the 48,000. So having been here now for almost 3 years, and as Christy and Cindy and others who have been on the executive committee can tell you, this is sort of a complete reversal of where we have found ourselves in the past. I won't say that we're flush with money, but knowing that we have money now, given the fact that the majority of you have been able to pay your dues up front, it really puts us in a much better position to be able to plan, to be able to know what we need to be charging for some of our events, to just really know where things are coming from. And so I think the conversations that James and I have had, and what I know that he's going to discuss next, about our finance committee and some of the things coming up, I really think we're in a good position to start some of that work.
Right, yeah, and I know we were supposed to have our initial budget and finance committee, but if it's been anything like what a normal, typical beginning of the school year is normally like, what this normal Delta variant and what a normal COVID has, it's been havoc. So believe me, I know was hard trying to get a meeting together. So hopefully we'll be able to get one together, hopefully either this month or at the beginning of next month.
Right.
But kind of like a rough plan of what kind of like a few things that we want to tackle with the budget and finance committee is we kind of want to look at the dues formula to see, do we want to stay at the $4 a child mark? And I know John has been getting some information from other states. And I know like around a few of the states around the border of Kentucky, like West Virginia, Virginia, some of them are at the $4 mark, $4.50 mark. And then there's some like the Massachusetts, where they go by like your grantee dollar amount. So if you're like at the $2 million to $4 million amount, let's say you pay like $2,000 plus you pay like a service charge, like an advocacy fee of like $2.25 per child. Right. Is what you would pay. And the reason why that I suggested we tackle that first, because in the bylaws that it has to be introduced to the board of directors and it has to be voted on by the board of directors within a certain amount of time before it gets introduced and put into effect, before it's official. So that's one of the things that I suggest we tackle first. And then the other thing is the financial guidelines, because I'm not sure when those were really looked at and really revised. So I suggested that we look at those again. And then just the third thing is that, so every time that we have a conference, we always do those silent auction baskets. So some grantees go above and beyond with the baskets. And then there are other grantees who sometimes forget, or so, yeah. So the suggestion that I came up with was having like a minimum dollar amount for the basket of maybe like $50 for the basket. And then because for the spring conference, it was, of course, it was online and it was only open for a few days. So I know there's a few of us who, when we went back to put a bid on the basket that we wanted to bid on, the auction was already closed. So possibly keeping it open for a few more days, or even for like a week or a week and a half. So discussing what that even might look like, or how we can bring in more revenue with the silent auction. So those are just a few things that the Budget and Finance Committee, I wanted to bring to them to see how we could tackle those three topics starting out.
Yeah, I think the silent auction that we did in April, I think the electronic tool that we use, sort of the online auction, I thought that actually worked really well. I thought it was very clear. I thought it was easy to use. I think the mistake that I made with that was we simply didn't have the auction last as long as we should. I think we could have had that auction last a lot longer, given that it is electronic, that it is virtual. It really didn't need to be tied to the dates of our conference. And I think that was just a learning thing. And so I think that we can really maximize what we can do with these online auctions by stretching it out over a week or two and really doing a lot of promotion with it. So it really could be an excellent annual fundraiser for KHSA and the work that we're doing. So that's good. Any questions about the financials? And the reason I say that is because there were some questions during the last board meeting, and that's why I sort of endeavored to create a new report that sort of boiled some of it down, made it a little easier to read. Because sometimes when you see these line items and these numbers, you're sort of like, okay, executive office expense. Okay, what does that mean? And what are we really spending our money on? And so that's why over here you sort of see it really is broken down into this. And the reason you see my name there is, like James said, is that I go out and pay for things and then I get reimbursed. So for instance, when I have to pay for the annual Microsoft 365, that is Excel and Word and all that stuff to use, we have to take care of that by printer ink and things like that. I really only submit an expense report once every month or two. So we just sort of let the receipts stack up, and then when we need to turn them in, we do. You see some of the other ones here. This is for our lobbying firm. We pay them on a monthly basis. We also do pay for our annual liability insurance for the association, as well as our director and officer insurance. So we have paid for our liability, and our director and officer insurance is coming our way at the end of this month. Other things in there, we have our standard corporate filings that we have to do annually with the Secretary of State's office. And then we have to make sure that we continue to be registered as a lobbyist with both the legislative and executive ethics commissions. So that just sort of breaks it down for you, and it's all there for you to look through. So I'd be happy to take any questions that folks may have about it, but I'm pleased with where we are, both in terms of the money that's coming in and the conversations that we're going to have in the future.
Are there any questions for James or John? All right, thank you so much. John, I'm going to turn it over to you to go ahead and do your report. Is Amanda, correct, Amanda was not able to join us today.
Right, Amanda's not able to join us today, so I'm going to go with her first. She was able to send in a few bullets for us. I'm going to put them up on the screen here so that people can see them. Can everybody see that okay? Yeah, okay. So she is sort of monitoring the special session. So these are the few items that she wanted folks to be aware of from both the Head Start Collaboration Office as well as the Governor's Office of Early Childhood. There's been a lot of talk about the revisions to the early childhood standards for Kentucky. The ECAC committee is going to be voting on those next week. There is every expectation that ECAC will adopt those, and that GOEC will then spend the next several months both creating and rolling out training all across the state so that everyone is able to shift their practices towards the new early childhood standards. One of the things that we're hoping to do as part of our upcoming October 20th, and I'll talk a little more about that, sort of one-day virtual event we're going to be doing, is we're hoping to have GOEC there as a part of it. And again, it's virtual, not in person, but we're going to have them there to give us sort of that 10,000-foot view of these new early childhood standards, sort of what you can expect, what you'll sort of be seeing what are some of those more major changes, if any, that you'll be seeing that may be impacting your programs. The next ECI conference that GOEC is putting on is November 1st and 2nd at the Galt House in Louisville. This one, as you see there, is going to be focused on helping the CECCs create action plans. And so the GOEC is releasing $6 million to enhance those action plans, and they're encouraging all the Head Starts to reach out to the CECCs and collaborate closely with them. One thing that I would note there is they say registration is now open, so visit the GOEC website because I think that the participation is limited within each of those CECCs. So I don't think it's necessarily limited to each participant, though I could be wrong about that. So you may want to go and visit that GOEC website just to make sure that you can get your folks there. And then finally, she has a couple of staff updates here. They've got a new person coming in who's going to manage that $6 million grant. And then they've got another person coming on board who is going to be doing professional development work for them. So just a few updates from GOEC. Like Andrea and Bill mentioned, they encourage folks to reach out to Amanda as the Head Start Collaboration Director or Officer. And so if you've got questions for them, reach out to her first, and she can sort of serve as that conduit, and then sort of as a director and maybe, you know, help get you where you need to go in terms of some of those conversations. I know that some of the conversations we talked about yesterday, James, sometimes that works, sometimes it doesn't, but it sort of is that first gate, and then can figure out where to go after that. So that's sort of the update from GOEC. Okay, so let me just hit real quick that virtual thing we're doing on October 20th. So if folks will recall, when we did the virtual conference back in the spring, I had said that if you'll sign up for the one in the spring, we'll give you another one in the fall. And so we're going to be doing just a one-day event rather than having concurrent sessions that are sort of going against each other. We're just going to have one continuous string of events all day long. So we're going to be starting off with Jeff Cordes again, who's going to be talking about some management, self-management issues, sort of a continuation of what he shared with us in April. We're also going to have the folks again from GOEC that are going to be talking about the new early childhood standards. Rhonda had suggested at our previous meeting that we maybe focus on some effective business meeting practices as folks are talking with policy councils and other groups how to run effective meetings. So we're working with the folks at the Kentucky Nonprofit Network to put together a session on that. And then I'll be working with the other sections to put together programming for the rest of the day. So more information is going to be coming on that, I would say probably next week. So you can expect to see that coming. And so we'll have that put together again. That'll be virtual, and folks just can sort of drop in, drop out of that as they want based on what some of those sessions are. Speaking of virtual sessions, we have next week, the 15th, the first in what we're hoping will be a webinar series, a monthly webinar series that KHSA is putting together. This particular one is in partnership with Frog Street. This one is the importance of intentionality in the pre-K classroom. This is something that Frog Street had come to us and said, hey, we'd like to partner with you guys. What sort of ideas do you have? And I had been thinking about ways we could work with them virtually. There had been a particular thing that my wife had done where she had participated virtually in some conferences and had some meals delivered, and you know, she was able to sort of participate in a way that made her feel like she was at that in-person conference, but it was still virtual and remote. So what Frog Street is doing is they've got this session put together, and I can guarantee you it is not a commercial for Frog Street. That was the first thing I told them was these people do not want a commercial. That's just going to be a waste of their time. What I need is something that is going to be important, something that's going to be current, and something that's going to be useful. So they have this particular session, and while they may talk about Frog Street at the very end, it is not a commercial for Frog Street. So those of you that have already signed up, I think we have 19 folks signed up for it so far. The target audience, it's limited to Head Start directors and education managers and directors. So those of you that fit those categories, you're the target audience. So I would ask that you sign up. The link is at the bottom of this particular flyer. You can sign up for it, and we look forward to having you on the 15th. Okay, just a couple of other items. Let me check my time here. All right, we're still looking good. We have our sections. And so I know a lot of folks have started to sign up for our sections. And so I've got just to show you here the numbers so far. We have 14 of our 28 grantees. So right at half have made appointments to our sections. That's really great because we've only asked you guys to do that over the last couple of weeks. So very good. So we've got our data and technology, disabilities and mental health, and you see the folks signed up there. Education, family services, and grants management and finance, and then health and nutrition. So those of you that have not yet signed up, have not sent me any information about your folks that you'd like to serve in these sections, please do so. I think I sent out another update this morning, but there's also a link to it in this folder. There's a separate piece of paper right there that has all the information you need in order to make those appointments. So I would encourage you to do so. This is going to be a principal way in which your staff is going to be able to engage with KHSA outside of any sort of formal conferences or trainings or anything like that. We certainly hope this is going to be the way that people are going to be able to begin networking together. Let's see what else we have here. Mention the sections appointments. We're going to be revisiting the compensation and benefits study. I've got a new person out of Chicago that I'm going to be talking with hopefully this week. And I'd like to come back and revisit that because that really is a critical question when folks are having their reviews. You've got to be able to answer some of these questions. And unless Kentucky is able to have some sort of a cohesive study and report on that, you're not going to be able to effectively answer that. So I want to make sure that KHSA is able to pull that together and be able to share that with you. So we're going to be coming at you again with those questions about compensation and benefits. So please be prepared and please have your finance and HR folks prepared to help us answer some of those questions. Other than that, we're going to be doing our congressional visits a couple of weeks from now. Those are going to be virtual because NHSA has shifted from a in-person to a virtual event for their Fall Leadership Institute. And so we'll be doing it just as we did last year. And that is those of you in the first district, we'll be having you meet with Congressman Comer, those of you in the second district, Congressman Guthrie, and those of you in the third, fourth, fifth, and sixth, and so forth. And then for Senator McConnell and Senator Paul, we'll invite everyone to attend, and those invitations and information will be coming out soon. So with that, I'd be happy to entertain any questions that folks may have. I know there's an awful lot going on. And we're going to try to have Sarah and Andrea and Bill with us going forward in these conversations because I know that that's invaluable information. I know that particularly KDE, they find themselves right now between a rock and a hard place. They want to say a lot of things to you, but they can't say a lot of things to you because the legislature in their special session has their hands tied. So we'll see what happens this week. Hopefully we will get another update this afternoon on what the legislature is doing. And once I have that, I will forward that out to you and we'll get a better sense of what is happening. So any questions? Okay, we are right on schedule. So I'm going to stop sharing and let me get my screen set here. Maria, how are you?
Okay, let me find my mic. I am doing well. How are you?
We are fantastic. Thank you so much for making the time to visit with us.
Absolutely. I mean, while we're on Zoom, I think we should take full advantage of these opportunities because once the world opens back up, it's going to get harder and harder to visit everywhere. So
yep.
Exciting.
So I've made you a co-host in case you need to share anything.
Absolutely.
But other than that, I want to welcome you. This is our board of directors meeting. We do these events. Right now, we're doing them quarterly. This group does get together for other things throughout the year, but we really welcome this opportunity to visit with you because we know that you have just started this position in the last few months, and it must be an extremely trying time to start a new position like this. There are so many questions and so many challenges. And these folks have a lot of questions for you. And I know that you have committed your career to helping. And these are your people.
Okay.
These are your people. So I'm hoping that we can have a really great conversation today. And we're so thankful that you've been able to join us.
Thank you. Thank you, John. I appreciate that. Well, greetings to Kentucky Association Board meeting. I'm excited. I bring you warm greetings from Atlanta, from the regional office. And as John mentioned that, yes, I am very new. We were counting it up just, I think last week, because, when the holidays come around, they kind of throw you off, right? So you're like, okay, was it last week or was it yesterday? I don't know. But we were counting it up and they were like, well, how long have you been here? And I said, wow, this coming Friday will be 4 whole months. And it feels like it has been an eternity already. But I'm excited about it. I'm excited about the opportunity. I always like to tell people just a little bit about myself, but I know that you guys read a lot of information, but I would say that I always say that I kind of grew up in Head Start in Ohio. And so my experience was with Region 5 because of the Chicago office. So I have just about done every aspect of Head Start that you can just about imagine. I started out as a home-based manager, so that was my first love. And then I moved on to childcare partnerships, where I actually had over 30 some childcare partnership centers from the beginning, from the inception of it, where if people think it's confusing now, it was completely confusing then. So we were just, hitting the ground running with that. And then I moved on to an associate director. And then we had I think it was a district director where we had quads. And this was in Columbus, Ohio. And we had quads where it was 4 of us and all of us took like 4 parts of our service area and divided it up. And so at that time I was responsible for about 1,200 families from beginning to end. And that's how we did the quads. And then from there, I moved on to become my first, because all the rest of them were associate director or assistant director or something like that. And then I finally moved on to become my first Head Start director in Columbus, Ohio. And then I took a position in Canton, Ohio as the Head Start director. And then I went to the school district. I always tell people I'm not going to say I had enough at that point of Head Start, but I'm going to say is that I had always heard, and in Kentucky, you guys didn't have this issue. You don't have this issue, never had this issue. But it was always this huge divide between school district employees versus Head Start employees and who would bring the better quality, right? It has always been that since the inception. And so I really wanted that opportunity to figure it out, so I had a chance to become the early Head Start coordinator at this particular school district. So I took that. And what I walked away with from there is that if you have the passion, no matter whether you're school district or whether you're Head Start, then you're a winner. And so, but if the passion is not there, I don't care where, which segment it is, it's not going to work. So then that was that. And then I moved to Atlanta and actually worked in a program. And then I just left working for the state of Georgia when I actually came over here to be the regional program manager. So just to give you guys a little background, I always talk about, anytime I get an opportunity to have a crowd, is that I love to think about things in an excellent manner. And so I really like to think about always moving in that direction. And so whether I will always get there or not, that is insignificant. The goal is that we're always going to push towards doing excellent work for children and families. And so we might fall a little short, but we're never going to fall short of the goal. And so that's where we go. So I'm going to share my screen with you guys at this point. And the information that I'm going to share with you actually is, I can't remember which meeting it was at, but if you missed one of the Head Start Forward meetings, it doesn't matter because I'm going to share a lot of that information with you right now. But also it's on eClick, which is another debate, whether it's eClick, eClick, or however we want to call it. It's one or the other. We all know what we're talking about. We always say, depending on what region you're from. So if you're from North, like if you're probably from Northern Kentucky, you might refer to it as closer to what the people in Ohio would say, and they usually say ECLIC. But if you're Southern Kentucky, you probably refer to it as ECLIC. It's the same way with Ursia, and it's the same way with that, depending on where you're from, how you actually pronounce it. Of course, we would say Ursia because we want to hear the A, because a lot of times people take that attendance and they don't do a lot with it. So we always want to make sure we put it in there. But needless to say, this is where we are. I'm going to change the way the screen looks and make it full screen. Can you guys see that? We're good? Okay. Wanted to just share a few things with you because I think it's important for us to, let me make sure I get my arrows together on how to move my screen along. Going too fast. I got it now. Yep, there we go. So during this small presentation, and I'm going to cut through the chase, I'm probably not going to read everything, but I'm going to give you all of the essence of it. But during this actual presentation, we will address, of course, because this is on everybody's mind. I don't care where you live at this point, it's on your mind. We will address COVID-19 activities, guidance, and regulations from the perspective of the Office of Head Start in Region 4. Particularly, we're going to address the public health safety, COVID-19 vaccines, masks for in-person services, oral health services. That's another biggie. Family style meals, transportation safety, and home visits. And then hopefully there's a few minutes left for some questions that you guys may have. I am going to change my screen so that I can actually, there we go, be able to see everything. Okay, a public health emergency still exists. I know in our region in particular, this is really not a question because being in Region 4, which covers 8 of the southern regions, we know that every day our numbers are rising higher than some other states. And so with that said, we know for a fact that the public health emergency is still in existing. And then how do we move through it, and how do we provide? So with that public health emergency, what is the status of the public health emergency? So the original public health emergency went into effect January 27th, 2020. Since then, it remains in effect it remains in effect for 90 days and can be extended. So it has been extended. So the new effective date is July 20th, 2021. So with that said, that yes, it is still there, and it is critical that we actually adhere to it because we keep hearing the numbers increasing and increasing and increasing, and we want to just make sure that that everyone is safe. I come from the standpoint, I want to make sure that families are safe. I want to make sure that our staff, that the staff is safe, and that, you know, that they're not vulnerable to things, and that they're not taking things home to their families, because they're just as important as everyone. So we want to make sure that everyone is safe with that. Will the Office of Head Start require that staff, the Head Start grantees get the COVID vaccine? I'm going to answer this one from this one. Basically, the decision to require vaccine remains a program and an employer specific decision. It's just that it's a decision that the federal government, we cannot make any type of recommendations for that at this point, even though your funding is federally, it is federal funding, it is still, you are still, as they would say, a private entity. And so there's still the laws that you would, that you would have to think about. But one of the things that I will leave with you with this particular slide is you want to make sure that that you look at whatever your state and local guidance are around this particular topic. And one of the things that I really want to stress is that you really consider looking into whatever the laws, your state guidance around making those decisions for your program. Private entities have done it across the country. Private entities are doing it right now. If you do, just make sure that you develop a policy and procedure, which is what Head Start lives and breathes on. As we all know, a policy and procedure, so that later on, after COVID passed, and then we start having our reviews, which we're going to hope to start having in-person reviews again in January of 2022. So after that, if it's ever questioned, as long as there's a policy and procedure that went into effect, then you guys are safe from a Head Start standpoint. But just know that we can't make any mandates or require any of those things at this point, although you're receiving federal dollars. Okay. Next slide. I'm going to make sure that I have my, my next slide. Masks for in-person services. So we know that Head Start, definitely the Office of Head Start want us to start getting back to in-person services. And so I say that from the standpoint, before I talk about masks, is I want to spend just a minute with that. And just to say that whatever your particular health department, whatever your HACEC committees are suggesting, whatever your local and federal laws are suggesting, is where we want you to go. Of course, we have already said that we want everyone to get back to in-person services for this particular school year. But if there are some COVID outbreaks in your community, then follow that. Follow your community resources and the powers that be in the community. As much as we say do X, Y, and Z, we do know that community health is most important, and that you follow those regulations. So in-person masks, Head Start programs should make sure that they should make masks universal requirements for adults and children age 2 and older. This is where the Office of Head Start is saying, and this is the direction that we would like. And it's just for the various reasons. And the reasons are, we know that there are no vaccines are currently available for young children. And one of the things I want to say with this one, is especially as we hear all of the statistics and look at everything across the board, we know that the Delta variants, for whatever reason, is favoring the younger population, is favoring children more so than the original COVID-19 variants when it was out last year, or when it's out last year, and even right now. But we know that the Delta variants that is really, really focusing in most cases, on the younger population. So since we know that there are no vaccines for children under 12, then we want to make sure that we protect that population as much as possible, the most vulnerable population, of course. And then the other reason, we want to make sure that adults are modeling. It is important for teachers, for teaching children healthy habits, such as, wearing masks. And then this is my own personal note here, is that, and I think we're going to mention this a little further down in one of the other slides, is that is being worn the appropriate way. And that is, for nose and mouth, and not having the nose exposed. And I know that is probably the most comfortable way of wearing it, but it's not the most safe. It's not the safest way to wear it. So wanted to just make sure that I highlighted that as well. That is critical that we model what we want. And then, of course, we know that the virus continues to spread, right? Especially in communities with low vaccination rates. But one of the things that we're seeing in Region 4 in all 8 states is that it's just on an increase in the majority of this region. So if I look at Alabama, if I look at Mississippi, if I look at, a lot of the states, that it is just really growing and growing. And we have to get that information so that we can think about whether or not there's some changes that we need to make on a national level, or some regional changes that we need to implement. But we just see that it is just expanding. And so I say that to say, make sure that we're all careful and that people are adhering to them, especially while they're in groups. Oral health and hygiene. Last year, toothbrushing was suspended. I remember when I think I was still at the state at that point with the program. And when that was one of the things that everyone was so nervous about, and they were just so concerned about the oral health and whether or not they were going to be out of compliance, for not providing it. So it was a sigh of relief when the Office of Head Start actually decided to suspend it for the 2020-21 school year, program year. So now, one of the things that they're saying is that, I'll just go and look at it. So it says programs should continue to promote effective oral health hygiene, for all children receiving services. Toothbrushing is in group care setting may resume if the program can implement strategies to reduce the possibility of transmitting the virus to other. And then basically here, when we're thinking about this particular group, we're looking at the salivary droppings during brushing. But the thing that I want to leave with you is that it is recommended that program staff help children with brushing be fully vaccinated against COVID-19 and wearing appropriately fitted masks, covering their nose and mouth for additional protection. So the recommendation here is that we definitely continue, because it's no longer suspended, that we negate the oral health, toothbrushing in particular. So with that, but the recommendation is that your staff that are going to assist children in brushing their teeth is that they are fully vaccinated against COVID-19. And then of course, still wearing the mask, right? And the fitted mask. So if you don't take away anything else, we know that they have lifted the suspension, and we know that what the recommendation is. And so it goes back to that question that we talked about earlier, whether or not you can mandate people having their being vaccinated. You can't necessarily do that, but the recommendation is that if we want to keep people as safe as possible, then while brushing teeth and being careful with that, making sure that the person that is assisting children has been vaccinated. Okay. So move on to the next one. Family style meals. This is another one that was a little bit concerning to people. Last year probably is still, I think as I look at other communities and I look at everyone, I think that we've done relatively well with this one, but there's still some fear out there, which I understand. Is there new guidance around family style meals? Here it says the CDC guidance say that they're at very low risk of transmission from food packaging, surfaces, and shared objects. And the shared objects come in because if we're looking at family style meals and we go back to the way that they were, where the child would actually serve themselves, then that's why they wanted to make sure that we talked about the shared objects, because a lot of times it's handling those spoons, handling the pitcher, and moving the actual dishes around. People have been so nervous about that. And I get it. But based on the information that we have, the transmission of these things are very low. And I guess they can't say that is no risk at all. We just know that is a very low risk. However, the recommendation in here is seating children further apart and providing as much fresh air as possible. And I know we all know that it's fall in Kentucky, right? And so especially for Northern Kentucky, in a minute by October, early November, it's going to start, the winds are going to get brisk and it's going to be a little cooler. However, that is one of the recommendations that they're saying, seating children further apart and providing as much fresh air as possible are parts of a layered approach to protecting children. Keep masks on until children and adults are eating. Staff should ensure children, this is really the biggie here, is staff should ensure children wash their hands prior to and immediately after. And we all know that if you've been in Head Start anytime at all, and we've done family style meals before, we made sure that before coming to the table, we had the hand washing time frames where we would probably be doing an activity and then you're calling them over, sending them to the table. The part that we might have done and we might not have done consistently is ensuring that immediately hands are washed after any meals. And so with that said, it is critical that we take that away, that we take that away. So if we haven't been doing that, that's one of the things that we want to make sure that we start to do even more frequently, because it's critical. That is probably one of the bigger things that will help us to not necessarily continue to transmit. And of course, we're going to put our masks and things back on immediately after eating, but the hand washing is critical that we actually take that away as well. And then here, transportation safety. For me, and then I probably shouldn't give my own personal opinion on these, but this one feels really challenging, but I'm sure that someone that does transportation on a regular basis, or you have policies, procedures that you have adapted to this that would allow you to actually do it in this fashion. How can programs support transportation safety? Programs should continue to position children as far apart as possible. We know that. With one child per bench, and children not seated in consecutive rows. If this is a possibility, then definitely. Then they talk about children from the same home. They sit together, which we all know that they have, that is possible. Then it says the vehicle operator and bus monitor should practice all safety actions and protocols as indicated for all program staff, including the use of masks and hand hygiene. Weather permitting, this is where it's okay for it now, maybe in some cases, because I think most people probably might still have the air on as they're transporting, but weather permitting, open windows on buses to increase ventilation on the buses. And so I say that to say later on, that's going to be more challenging. So hopefully things we'll see a turn for, where we'll start seeing numbers drop again. But at this point, we know across Region 4, the numbers are growing and growing. But again, keeping the windows open as much as possible to increase the ventilation will help in transportation and transporting children back to and from the program. And then my last slide before we get into questions and answers is home visits. And I know that this right here is a huge one for rural communities. So with that said, how can programs support home visits? How can programs support safe home visits? When we're looking at safe home visits, this one right here is really important for us to think about before entering a home visits and other Head Start staff who make home visits should first assess their own risk. And again, I think I mentioned this earlier that our staff is critical, that our staff is just as important as everyone else. I remember in my early years of Head Start, it seemed like we were always focusing in on the families. And one of the things that I always made sure that in whatever leadership role I had, that we were always focusing in on everyone, all inclusive, because our staff is equally as important in order for the parents and the families to have a successful Head Start program or early Head Start. Then we wanted to make sure that our staff was, equally important. So we want you to assess their own risk of transmitting infection or risk of complications. That is critical. We want to make sure that you really think about your own health if they get infected. Then the other aspect is that they should also identify family members and the visit home and the visited home who may be at a great risk of transmitting the disease or having complications if infected with COVID-19. Home visiting programs should contact families prior to the home visit and ask about the following. And this right here, 1 and 2 is really important. And these are the questions that I don't care where you go, just about with any services. I went to have my eye exam and they asked me these questions. Signs of symptoms or of a respiratory infection, such as fever, subjective or confirmed of 104 or higher, coughing, sore throat, soreness, or breath, shortness of breath. All of these things are being asked on a constant basis. And even for your home visitors, these are the things that we want them to know ahead of time. And if that is happening, then we want to make sure that they don't participate. Contact with anyone. I just had this question. I can't remember where, but I just had this question, contact with anyone with COVID. Oh, because I did a COVID test about a week and a half ago, and that was the first thing. And a lot of times you really don't know, because a lot of times people really don't know if they have it or not, because you can actually just be a carrier with 0 symptoms. And so you really don't know. And we know that if we knew someone and they told us, then yes, we can actually talk about that. But a lot of times you may come in contact with someone and they're not even aware that they have it, because they could just be a carrier and show no symptoms. Known exposure to someone with, suspected or confirmed COVID-19. With all of these things, one of the things that we really want you to know is that to please just ask these questions, protect your staff, maybe face-to-face visits. If some of these things are happening in some of your family homes, is not what you can do at this point. But think about other means. I know during as we can say, the heat of the pandemic, we actually were able to do home visits differently. And so if there is a risk to your staff going in, taking it back to their staff, then you want to prevent, you want to guard against that. If it's a risk of your staff going into someone's home and taking it to the home, then we want to prevent against that. So for home visiting, and particularly in rural areas, you really want to think about other opportunities in the event that you can't really go into that home, or your home visitor is not well enough to go to that home, or if they have young children in their home. There's a lot to take into consideration. So I really wanted to just flesh that out, because it's really important for you to think about all aspects of what we can do regarding home visits. So I believe that this is my last slide. And we can actually, I want to make sure that I didn't leave anything out. Okay, I didn't necessarily leave anything out. So I want to move on to questions and answer at this point and see if there's anyone that have any questions, anything that I can entertain in answering. And I'm going to stop sharing so that I can actually just look directly at everyone while we're communicating. I think I see a hand already. I think Jessica.
Yes, how are you doing?
I am well, thank you.
Great. So I have a question about, as you know, or may not know, the numbers in Kentucky are steadily rising. We have seen so many classrooms that we have had to shut over the past probably just 2 weeks. I'm wondering, will there be any provisions, or have there been any conversations at the regional office about having waivers for some of those 45-day documents or requirements? Just because we'll open a classroom and shut a classroom, and our 45 days is just about up. So I was wondering, have there been provisions, or could we submit a waiver for some of those items?
Thank you. Really good question. At this point, there has not been any discussion about a waiver, because what we are allowing programs to do is, because believe it or not, Jessica, you're not unique. There are so many communities where, and again, pretty much Region 4, most of our programs start classes even as early as the last week in July to the first week in August, right? So we know that if we look at it from that standpoint, today is September 8th, we know for a fact that that most people are getting close to that 30 to 45 days, you might be 15 days away from it. So what we're saying to everyone is, again, like everything that I mentioned, pretty much opening back up, coming back in person to person, providing home base, providing family style meals, toothbrushing, all of those things are predicated upon whether or not where you are in your community. So for an example, like you're saying, everyone is actually, they've opened up classes, they've already started, they had to close, a couple of them had to close a couple centers, right? Because it was rampant there. And so they closed the whole center. What we're saying is that basically what we would need is just your documentation that you ended up opening on time, had an outbreak in one of your locations, had to close, something came up. If you can document that, as anyone that's been in Head Start for more than 24 hours, we all know, right? Documentation is the key to everything. So if you can actually document your outbreaks and the things that hindered you, then you're not going to be out of compliance. But at this particular time, there has not been anything that has come down to say that we are allowing waivers on it. So, that may be forthcoming, because again, as we can see, it is just, I don't care what state I talk to, it is just growing and growing and growing, even to the point to where we're all like, oh my goodness, it feels like we're, getting ready to go back into something that we don't want to, right? So with that said, I wouldn't panic about your 45 days. I would actually just document everything and you'll be fine. Just document it. That's it. I hope that helps. I hope that helps.
Does the same thing apply to your full enrollment expectations? Because we lost 2% of our enrollment when the mask mandate came out for children in this age group.
So right now, we know that the mandate for full enrollment is that we're moving towards that, right? As of January of 2022 is when full enrollment, the full enrollment protocols will be back in place, that you must have it and you can't be under, for 4 months in a row, right? We know that doesn't officially start until January. And that is where we are today. If this thing continues to grow like we see it, then perhaps there's going to be some other mandates coming down or some relaxing of that January date, but we can't predict that in September. We just have to see how it's going to play out. So right now we know that you want to continue moving towards your goal of full enrollment. You're not going to be out of compliance if the month of September is not fully enrolled, because we know that people are still struggling, and we're not going to start counting those things again to the degree of the actual standard, right? Of the regulations that's in place until January 2022. But then that's September, we're talking on the 8th. Who knows what's going to happen by September 30th? In all honesty, there may be something that we might be quickly putting together to send out if this thing continues down the road that it is. But right now, those are the rules that you're moving towards full enrollment. You haven't reached it, yet, and you're not going to be out of compliance if you can show the documentation, right? Because we know that we live on documentation. So if we can show the documentation of where we are and the things that have happened to hinder, then you'll be fine. But again, what we're saying by January of 2022 is where we're going to start, adhering to the policy, to the actual standards, again, where full enrollment is required. And that is in September. That's what we're saying. We'll see how that plays out in January. I hope that helped, Rachel.
Yes, it did. Thank you.
You're welcome. Thank you. Other questions, thoughts, concerns? As people are thinking about other things to ask me, I just want to say, stay safe. As be careful. Love on people at a distance. protect yourself. The older I get, the more I tell everybody it's really critical that, you know, when I was younger, of course, I thought I was invincible. Right now that I've turned some corners here, it is imperative that we actually just think about even taking things home to people that you love. You want to be careful even going home with your families. Again, for whatever reason, the Delta variant is really favoring the younger population and even the elementary children. I mean, I have schools in the Mississippi area that opened the last week in July, and they have been closed for the last 3 weeks. And we have a new program that they were trying to figure out how to get open in that time frame. It's not happening. It's not happening not because of, other things like licensing. It's because of the actual Delta variant. So,
could I ask one question? We know that there is a history of federal dollars that flow to states are often used as a carrot to get states to adopt specific standards or specific mandates.
Mm-hmm.
Given that Head Start, though, is not money that flows to states, it's money that flows specifically to grantees.
Mm-hmm.
Could you ever envision a period, given that we have the Biden administration on one end of the spectrum and many, many states and governors and legislatures on the other end of the spectrum? Could you ever envision a world in which, despite the fact that we want Head Start programs to abide by local and state standards and guidance, that guidance just isn't good enough, and that Head Start simply has to finally one day say, if you're going to be spending federal dollars, you need to do A, B, and C?
Mm-hmm. You know what? That's a really good question. It's really funny that you would ask that question, because about a month ago, I had a similar question from another, I think it was another state association actually, that was connected to, in some kind of way, it was through the state, and they were asking a very similar question. And the answer is that I think that these things have been tried for the last 20 years. And we're still where we are right now, because there's, on one hand, people say that if you send this particular federal dollar to the state, a lot of times it could get lost in the school districts. I mean, I'm not saying that that's true or false. I'm just telling you what some of the people are saying. A lot of times they're saying that, it's better for it to continue in the direction that it is. It has been avocation on both sides. Whether or not it will ever get to that bridge is up for, for all of us that will be here long enough to see it turn that corner. I think what they tried to do some years back, when they actually put the collab directors into various states, so that and some of them work extremely well, and some of them are still trying to figure it out. But I really do believe that was the role, and only because I've worked with several collab directors even before I got here, that was the role for them to inform or keep everybody together. Because think about it from this angle, that the actual, the child welfare dollars go through the state, and then that kind of comes around where the state utilizes that, and then they can actually build the gap between the Head Start and that, but it's all federal dollars. So I really do believe that was their first effort of trying to bridge that gap, when they actually put the collab directors. And again, some of them work extremely well, and some of them are still trying to figure it out. But I think that is the bridge. And if we can actually get those working better, then we might see some of the things that you mentioned.
Yeah, I'm certainly not advocating for the state being involved when it comes to the funding or oversight or anything like that, because I think the way it's set up now is the way that it should work. I mean, you really need a direct relationship. Take the middleman out. You don't need that.
Right.
At the same time, though, I guess I'm more concerned about if a state is, let's say we've got kids getting sicker and sicker, and we've got a state that is not introducing any mandates, any standards. They're saying, hey, we're not doing anything. Superintendents in your district, school boards, not doing anything. Mm-hmm. Is there ever that point where, the administration steps in and just says, enough's enough?
Right.
If you're going to be spending federal dollars, you need to be doing, you need to be having this and that. So anyway, it's a speculative question. We haven't.
John, I hope you and I both can get there. I hope we can both see that, because it will be interesting to see it. So hopefully,
we'll see what happens.
Yeah, we will. Cindy?
Yeah, real quickly, I know there are not decisions or specific directives, but can you speak at all to conversations about universal pre-K and or expansion opportunities for funding for either Head Start or early Head Start?
Yeah, it was a huge, as a matter of fact, you want to hear something funny? That was going to be part of what I was going to talk about, the universal pre-K, but then we felt like there wasn't enough time. So we were like, okay, everybody has COVID on their mind, right? I mean, that is like, what are we going to do with COVID? So we chose COVID over that. But there is, in one of the Head Start Forward meetings, it was one of the very early ones. I want to say like the May or early June meeting there. And I can even send this to John and he can get it to you. I can send this out after my staff meeting this afternoon. I'll send that out and you'll see it. It really does talk a lot about universal pre-K in this administration and how the funding is going to start rolling out. If it's not in this fiscal year, 2022, I believe it is though. But let me just get that. I'll get that to him and he can send it out to whomever he desires to. That is funny that you would ask that question, because we were like, well, for sake of time, let's take this off because everybody's going to want to know about COVID. And you asked a question about universal pre-K. So I'll get it to him. Okay. Any other questions?
Maria, this is Christy Lewis. I'm the Head Start Association president. I just want to thank you for your time today. We really appreciate you joining our great state of Kentucky, and we hope that we'll be in person in the spring, and maybe you can be in person with us to get our conference started off well, and see how the year's going. So I just appreciate your time today.
Thank you so much. I appreciate it. Thank you. And you know what, Christy, where you're positioned in my Zoom, you're like right in front of me, and your actual head knobs were really affirming. So I appreciate that. Thank you so much. I don't see any other hands. Anything else, John, that you would like for me to talk about or say?
No, ma'am. We're just so appreciative of you making time to join us today.
Absolutely. I will skedaddle and I have a 2:00 staff meeting. There was a couple more things I wanted to add on there. So I will just go ahead and look on that on my agenda for that. But thank you guys. Again, I leave this with you. Stay safe, love people, take care of everyone as much as possible, and protect yourselves, okay? Because these are very trying times. And be kind to your staff, because although our mental health is good, their mental health may not be good. So take care, everybody. Thank you so much. Take care. Have a wonderful day, the rest of your day, everybody, okay?
Thank you.
Thank you. Bye-bye.
All right, gang. Thank you very much for sticking with us. I know we have had a long session today, but I think it has been quite informative for us. So the final presenter and presenters that we have with us, we have John Finley with Medformance, and we also have a couple of other folks that I'm going to ask John to introduce, and we also have Whitney Pyle, who is on the team with Cindy at Murray. These folks are going to speak to us today about I don't know exactly how to describe it, John. It's an air system, but it's also sort of when we think about COVID, this is the perfect time to be talking about something like this.
Yes.
Certain changes to classrooms, changes to buildings, making sure that we're creating safer environments. So why don't I turn it over to you? And of course, Cindy, you jump in here anytime when you think it's necessary, because I know you've got some great experience with these folks also. So John and the other folks at Medformance and Whitney, I've made you all co-hosts, so you can go ahead and share whenever you need to.
Awesome. Well, John, thank you for this opportunity. You know, when I reached out to you 2 weeks ago, you know, we were trying to kind of bridge that gap and try to reach out to you and talk about, you know, not only our company, but also providing safer solutions to Head Start facilities. And we are in the air purification device industry. We have some other products as well, but that's what we're tried and true with. And we do believe in the value of associations and co-ops, which is the reason I reached out to you. Now, I thank you for this opportunity. We do have an A team here with me today. We have Brad Cleaver and Damon Faulkner, who are the vice presidents of sales. John Nice, the VP of marketing, and then of course our rock star Whitney Powell, who of course everybody probably knows. She's an RN health services coordinator for Murray Head Start. And so as you see the slides up, I'll let Brad and Damon start speaking, and John to the slides. And as again, John, thank you for this opportunity.
Yes, thank you, John. My name is Brad Cleaver. We first want to just give thanks, obviously, to KHSA for allowing us to provide some information to you guys of what we're doing to help combat the issue that we're all trying to deal with. I want to tell you a little bit about the company real quickly, and we'll get through this. And I know you guys have been here for a while. So the name of our company is Medformance. We were created back in 2018. Our core competency has been in the pathogen testing arena, and that's where we've spent most of our time and through our company. But my true passion is basketball. I'm also the head basketball coach at Callaway County High School in Murray, Kentucky. And it was that relationship that really led me into speaking with administrators, not just administrators at Callaway, but administrators across Head Start, obviously with Ms. Graves and other programs as well, and really identifying of there's some real issues out there. Are people as people are trying to identify a layered approach to do everything they can to keep kids and staff in schools. And it was very apparent to me early on that, you know, a lot of this conversation we came in today was speaking to federal dollars. And obviously there's federal funding for school systems, and therefore they're being sold by a lot of vendors that are reaching out, trying to sell certain things. But the one thing that stood out to me being a healthcare company was, where's the data? And I said, here's an opportunity that we can help inform these administrators and school systems about proven healthcare technologies. And so our goal and our mission in Medformance is very simple. It is we want to bridge the gap between proven healthcare solutions and school systems. And that's exactly what we've done. Next slide. One thing that we looked at, we also looked at what are the solutions out there currently on the marketplace. Now it's across the board, as you guys know. These are two solutions that were failed solutions. And even though the technology of UV lighting is effective, you need to understand how it works to be effective. And so there's a time of latency where, you know, the UV lighting has to be over a certain pathogen or virus for it to be effective. Also, you had, and this was tragic because the light actually came on during school, and it was a nightmare. And you also have, you know, folks have tried to create learning boxes, if you will, for kids to try to isolate them as much as possible. Well, there's obviously some bioburdens with that. It became little petri dishes really is what that became. And we look to identify what is the best product and services that we could bring to the marketplace to actually help address issues at the source, at the classroom, where our kids are, where our educators are. And that's what we've done. And John, you take this slide.
Yeah, this is just a very good illustration of what goes on with the aerodynamics in the classroom and how bioaerosols are transmitted. So any pathogen being anything that causes an infection or disease, as they're floating around on these bioaerosolized particles, it came to be apparent that the place that this battle needed to take place was in the classroom, where kids are inside, where people are inside breathing. So we'll go through this pretty quickly, but it took us almost 6 months of research to find the right solution sets. There are many solutions out there, but again, what we set as the bar for us is if we go and talk to a medical director, do we have evidence of efficacy for the given application? And if it didn't pass that bar, we don't talk to schools about it. So we've kind of set a higher bar than many other people in the marketplace. This technology is unique. It is, as far as the physics go, it's much like a lightning strike. And the result is very much the same. Whatever happens with a lightning strike happens with this. So this is probably going to be the best way to do it. We'll play the short video, 2:33. They did an exceptionally good job of putting it in a context that can be understood by people other than Whitney.
At the core of Noveris's air disinfection products is one of the most powerful patented nanoscale technologies. NanoStrike is a lethal weapon in air disinfection and virus destruction. This unique plasma-based nanotechnology kills all airborne microorganisms by using coiled tubes that are surrounded by an atmospheric plasma discharge. The discharge provides a deadly strike that kills and deactivates all harmful microorganisms, such as viruses, bacteria, and fungi, as they pass through the plasma field. This patented technology harnesses multiple pathogen inactivation processes in one powerful strike. It destroys DNA and protein in a sub-second time frame. This stops viruses from spreading and bacterial and fungal spores from reproducing. Unique to NanoStrike is its ability to attack the cell membrane, DNA, and protein, causing osmotic pressure, which quickly bursts a pathogen cell, providing no way for the cell to self-heal or develop antimicrobial resistance. NanoStrike's effectiveness lies within its ability to kill and deactivate even the smallest nano-sized pathogen on contact. As microorganisms pass through the NanoStrike plasma field, they are rendered inert and deactivated. Therefore, only harmless dead pathogen debris emerges from the field. In contrast, filters collect live pathogens, allowing them to breed, creating in effect a new source of bioburden. Also, some viruses and bacteria can potentially breach even the most efficient filter and can continuously release into the indoor environment. Noveris's NanoStrike technology is the first line of protection against airborne viruses and bacteria, providing clean and safe indoor air.
So, there we go. NASA put this slide together, and I'll fly through these because I want to get to the most important part, which is what Whitney probably has to say. 2/1000ths of a second is the time it takes for these coils to completely deactivate and destroy pathogens. And the other benefit we'll look at in a moment. As we looked at asthma triggers and things that happened in schools, these stats are all from the EPA. It's a significant problem. And the fact that this technology can also deal with the fungi, the molds, particulates, and even reduce VOCs really gives us an advantage to look at two problems we solve. The first being the challenges with the airborne pathogens and transmission, the second being improvement in air quality. So on the air quality front, these are the mold symptoms that physicians are trained to diagnose from. These are the actual mold symptoms. So it is a plethora of things. Mycotoxins are even capable of causing cancer. There's a lot of things that are developed as a result of molds. So this is probably a great place to transition.
It would, and as we really, we'll talk about the clinical studies that we have access to as well, but this would be a good opportunity for Miss Cindy and Whitney. If Whitney's with us, we've put units in their facility, and they've tested these units now for a couple months, and they have some real world feedback. And so I'd like to turn it over now to Cindy and Whitney just to speak about why they felt the need for it and how it's worked for them so far.
Thank you all so much for allowing this time just to kind of share with you about the Noveris products, the Medformance products. and Cindy, feel free to jump in here as well, because I know you and I have teamed up on this and have really approached this head on. We did have some staff members here at our central office that had reported a variety of symptoms, and these are not COVID related symptoms. This was, just being in the building type symptoms of, a burning throat, sneezing, watery eyes. And I can say another coworker and I actually had developed dermatologic symptoms. I developed a rash on my arm. She developed a rash on her face and neck. And it would be sporadic, sometimes worse after rain, but regardless, they were symptoms nonetheless that we felt were related to the fact that our offices are located in an older school building. And so when I talked with Cindy about it and just my concerns about it, we at first had bought dehumidifiers to think that maybe that would help take some of the moisture out of the air. And although they were collecting moisture, our symptoms really we really didn't see much difference in them. So that's when Brad Cleaver actually came and spoke to Cindy and to me about the Noveris products. And so Cindy and I honestly, we were like, we have nothing to lose, but only to gain. And this has got to be a great solution for us because of how they could fit in our office spaces. They're quiet, just lots of good solutions to it. And with Head Start and a lot of our decisions are data driven. What we asked John and Brad to do, if possible, was to kind of do a pre and post test for us regarding, before installation and after, just to see if the actual quality of the air improved. And so they were able to do that for us and provide us that data to show the benefits of having the units in our offices. And it didn't take long for them to do that. It was right before installation, and then they came back a few days after installation and retested. And we got results within, I would say, a week or so of having them installed. Bottom line is that after we've had them installed, the symptoms that I mentioned that coworkers were having, we're not having them anymore. The other thing that was also told to me was that sometimes our offices, after a longer weekend or a break, we'd come in and they would smell musty. We're not having that either. So, which I thought was an interesting observation. So honestly, post installation, our data did show improvement from physical to just numbers on paper as well. So we've been very fortunate, I think, in being able to install them in our offices, and then for having Medformance as a resource. And so I know now we're having them installed in all of our early Head Start licensed centers. And so we'll be able to tackle that as well. Cindy,
Whitney, I just moved around in my office just to give people an idea. Sometimes you see a box and you think it's this great big old wieldy thing. That little white square that's on top of that file cabinet next to the bookcase, that's all it is. Mm-hmm. It's turned on, it runs 24/7, but it's no bigger than those file trays that are right beside it. So just to kind of give people a perspective of the device itself.
Yep. And mine's right behind me as well. So, and they're very quiet. So that part is, I like too. I like a little bit of white noise, but it is very quiet. You just clean the filters out in them once a month, and you can do that with warm running water. So it's pretty simple.
Thanks, Whitney and Cindy. We appreciate that. I know we're kind of getting tight on time here, so we'll go through some of the other slides pretty quickly so we can get to a question and answer. John, do you want to take this?
These are actual some of the labs we won't show real long, so Cindy and Whitney don't get in trouble. But we did experience significant reduction across the primary things we test for: bacteria, mold, fungal spores, and then we also take readings on VOC particulates. Those are more just for trending data. What we're trying to show is a reduction, and we had significant reductions across the board. The neat thing to remember about viruses, infections, is you don't have to eliminate it. It's not the Andromeda strain. Taking those numbers down significantly can be enough to have big impact. When we looked at technology, everybody and their brother has something that will remove 99.99% of SARS-CoV-2 or similar viruses. But that's in a box. So they're really looking at a very controlled setting. And the data that we look for is, this is real life. There's doors opening and closing. There's kids running around. What were the reductions in case counts? So when we looked across the top of this, the data was very encouraging. Over 70% reduction in case counts for respiratory infections across 9 studies in hospitals. That's meaningful data. And so that was significant. Brad, I'll let you take the ROI.
And so we looked at, again, and this is kind of a summary, we'll turn this into a summary, is the return on investment. Obviously, everyone is providing a layered approach to do whatever they can to create a safest environment possible for our kids and staff. And that was due to COVID. What we've done is we brought a product to the marketplace that's not only going to address the COVIDs and the flus and other respiratory viruses and bugs, but we're going to address the air as well. So improving that indoor air quality is going to have a positive impact on your kids with allergies, on molds, on your staff. The air is just going to be cleaner. And obviously that testimony from Whitney and Cindy is very powerful to us, and it's why we're having success. And we're rolled out right now in the University of Tennessee, Knoxville. We have a very nice program with them in every classroom. McCracken County as well, and as we're talking to many other school systems throughout the state and throughout the country. And ultimately, the message is, the message that we're giving to the community and helping schools to provide to the community of a better overall health, better indoor air quality. And when the community realizes what Murray Head Start has done, I know the feedback is pretty phenomenal from the parents that know. While they're actually working to clean the air and using products that are being used in long-term care facilities and hospitals now across the country, and that's a positive impact. And we can all use a positive impact in the times that we're going through now as a team. And I'll leave that. I'll open this up to any questions that you guys may have, or if you guys have questions for your colleagues, Cindy and Whitney.
Brad, I think one of the differences when we were talking early on about various kinds of products and the nanostrike technology versus the products that collect those particles on a filter, and then you have to dispose of, of the toxic particles safely. And a lot of times we don't think about that. And that was a big piece that was of interest to me when we were making our decisions.
No, it's a very good point. It's patented technology that is not filter technology. So it does have a filter that looks like a dryer sheet. It's only to protect the fan. Whitney spoke to that earlier. It's a very, very low maintenance product. That was very important to us as well, coming to market with a product that was very, very low maintenance, and it would be ideal for school settings, for average room sizes of 800 to 1,200 square feet. And that's a key point to why this product works very, very well in classroom settings as well as office settings.
So I guess the golden question I have is, what is the price?
And that's something too, is, and we would need to talk probably with Mr. Mountjoy as well to decide, if this going to be a project that, all the facilities are going to look to going in. Obviously, if we could create a GPO scenario, obviously like we do with Greg and some of the other GPOs that we work with, we'll do whatever we can to work with you guys. The MSRP on one unit is just under $2,500 for a unit, which comes with a 3-year warranty, full replacement warranty, no additional cost. So it's very important to know there are no hidden costs. It's all up front, and it comes with a 3-year replacement warranty. But obviously, I don't want to be presumptuous at all. So Mr. Mountjoy, I'll defer to you on if there's a lot of interest and we can create a GPO scenario, we will do our best to work with you guys to make sure we can help as many people as possible.
And just to piggyback off that, we are, as Brad said, part of GREC and WKEC, and those are over probably 65, 70 school systems in the western central part of the state. And they put us through quite the pricing exercise to get these down to prices that schools would be able to afford. So we'd be glad to share those prices though with you, Mr. Mountjoy, and let you look over that and see if that would be something that you would feel would be reasonable for your association.
Very good. Be more than happy to share that information with folks and sort of get a feel from everybody who's on the call and share the information with those who aren't.
Sure.
And I think we'd be open to, if there's anyone that has questions or wants to dive deeper, there's a lot of information out there. There's over 45 studies on the manufacturer's site. We've got quite a bit of content speaking to the layered approaches and things like that. So there may be good material out there that you can leverage or that people can leverage if they want to learn more.
Excellent.
Thank you.
Yes, thank you.
All right. Do folks have any questions? Any questions, any comments?
I just wanted to say thank you. I appreciate your time. I've heard about the product. I'm here in Paducah, and so we have had those discussions. And yes, so I appreciate y'all taking the time to share with everybody else.
Thank you.
Thank
We
you.
appreciate you.
All right. Very good. Thank you all so much for joining us this afternoon, and we will be
Thank
in
you.
touch.
Thank you.
All right, Christy, I'm going to turn it over to you to close us out.
All right, sounds good, y'all. I hope we have had a very informative meeting today. I greatly appreciate your time. That sailboat at the end, that was perfect. I mean, isn't that a perfect visual for all of us to be relaxing today? So maybe that yacht is somewhere we all need to put on our go-to list for today. Anyway, I hope you have a great afternoon. It is Wednesday. And so here at Paducah, we always say it's wonderful, wild, and wacky Wednesday, and it's definitely been that today. So have a great afternoon. As Ms. Goss said, take care of yourself. Take time for you tonight, but more than anything, take care of your staff. Check in with them and give that extra grace this evening. If you're able to let them go early, just tell them to go home at the end of the day when they can and take a breather for them and their family. Y'all have a wonderful afternoon. If I can do anything for you, please let me know. Thank you. With that, I adjourn our meeting. If anybody else, Cindy, can I get a motion to adjourn?
So move.
Awesome. Y'all have a great day. Thank you.
Thanks, everyone.